Population Biology and Human Populations Part 5 will focus on the economic, cultural, and political factors that influence the natural increase rate of a country, the natural increase rate of a specific subset of the world's human population. The significant ideas are a variety of models and indicators are employed to quantify population dynamics. Human population growth rates are impacted by a complex range of changing factors, and any system has a carrying capacity for a given species. Here is an outline of all the available movies for population biology and human populations. Use this outline to find the movie you need for review. This movie is focused here. While the human species would be classified as a K-strategist, the availability of fossil fuels has driven exponential growth in the human species that began with the onset of the Industrial Revolution. But even in 2013, we're still growing exponentially. From 1927 to 1974, the population doubled from 2 billion to 4 billion, a 47-year doubling time indicative of a 1.5% natural increase rate. But from 1959 to 1999, the population doubled from 3 billion to 6 billion in 40 years. The natural increase rate through this period was a stunning 1.75%. Now, the implications of exponential growth in the worldwide human population are that natural limits will begin to resist the growth. Environmental resistance in the form of density-dependent limiting factors are already beginning to appear for local populations in the form of food shortages, water shortages, and one could argue, the spread of disease. In this graph of human population growth, the time scale on the x-axis is expanded over a greater period of time than you see in other graphs. This is a scale that emphasizes the dramatic nature of our recent exponential growth. Humans, unlike other species in nature, have been able to increase their food supply using fertilizers and irrigation techniques and hybrid seeds. Humans have eliminated many competitor species to increase the amount of land under cultivation for food, and humans have increased water availability by drilling for groundwater. Humans have reduced the effects of disease through vaccines and cures such as penicillin. Throughout human history, our technological revolutions have increased the carrying capacity once, twice, and 3 times. Tools that increased the effectiveness of hunting or fishing increased food supply, and we arrived at a new carrying capacity. Domesticating plants and animals in early agriculture increased food supply, and we arrived at a new carrying capacity. And the availability of fossil fuels kick-started the Industrial Revolution that increased food supply. In parallel with the increased food production, humans have increased the area under cultivation by out-competing wild species and reducing the effects of other density-dependent limiting factors by harvesting groundwater, reducing disease, and improving sanitation. This S-shaped curve of the human population on Earth projects population size out to 2150. But notice that most of the growth over the last 100 years has been in the less economically developed countries. The explanation for this difference in growth between the less economically developed countries and the more economically developed countries is rooted in economics, culture, and politics. Remember that if we're interested in the growth of a population, we have 2 important statistics to examine: natural increase rate and total fertility rate. Natural increase rate is defined as crude birth rate minus crude death rate, keeping in mind the possibility of including immigration and emigration in the calculation. And total fertility rate, TFR, is defined as the average number of children women give birth to in their lifetime. Now, theoretically, a total fertility rate of 2 is 0 population growth. But a country with a TFR of 2 may still have a positive natural increase rate because of a large pre-reproductive cohort growing up into what will become the reproductive cohort. In this table, you can see the correlation between natural increase rate and total fertility rate. India and Peru both have relatively high natural increase and total fertility rates both, while Germany has a negative natural increase rate that is strongly associated with a total fertility rate much less than 2. For those countries like Brazil or China, where the total fertility rate is less than 2, this does not appear to correlate with positive natural increase rates. But keep in mind that there is immigration and emigration that may factor into the natural increase rate. And also remember that population growth continues over a generation of time as the large pre-reproductive age groups grow to replace themselves in the reproductive cohort. This is called population momentum. The factors that influence the natural increase rate of humans is far more complex than those that influence the natural increase rate of wild populations. In this slide, I have not included the internal factors that influence the growth of a human population. I've left off the internal factors because clutch size and age of reproductive maturity are not very important in the growth of human populations. Instead, in human populations, economic, political, cultural, historical, and religious factors are more important influences on birth rates. The economic, political, and cultural factors that influence birth rates are the subject of this movie, and maybe you can already name a few of these factors. Now, the external factors, such as food availability, water availability, and disease, remain important in the growth or decline of local human populations. These external factors are the density-dependent factors, the environmental resistance that limits human population growth. Here's the relevant IB syllabus statement. Discuss how national and international development policies, population policies, and cultural influences, like the changing roles of women, can affect human population dynamics and growth. Here are the first 5 factors that influence human birth rates and thus human population growth rates: level of education and affluence, level of education and employment for women, access to birth control, improved public health and sanitation, and level of infant mortality. Let's look at each of these just a bit more closely. When women are educated and in the workforce, no longer is their primary job that of bearing children for the family. With education opening opportunities for employment, women can better control the direction of their life. Employment becomes important in the life of a woman and often results in postponing the rearing of children. Government policies that strengthen education for women, policies that provide equality among men and women, serve to reduce birth rates. Government policies may not work, however, if local culture is more conservative, such that equality of women is resisted. In order for birth rates to drop, cultures must wipe away the traditional view of women as simply that of bearing children for the family. In order for birth rates to drop, cultures must move toward equality for men and women in all spheres of life. Having access to birth control limits the number of births. If couples cannot afford or cannot procure contraceptives, births are more likely, more frequent. Government policies that promote or provide access to birth control will serve to reduce birth rates. Clean water, access to public health, and sanitary living conditions all contribute to lowering infant mortality because they reduce the impact of disease. Through government policies that reduce infant mortality, couples can depend on their children living through infancy, and thus they are more likely to have fewer children. The level of infant mortality is often seen as the most important indicator of development. for it reflects how we care for our children. Defined as the number of children who die before the age of 1 per 1,000 live births, you can see by this graph that infant mortality in more economically developed countries is less than 10 per 1,000 live births per year. When government policies provide the assurance that children will live through infancy, couples have fewer children. But in less economically developed countries, the infant mortality rate can be quite high, and birth rates in these countries remain high as well. Here is a second set of factors that influence birth rates in human populations: availability of a pension at retirement, average age at marriage, urbanization, importance of children as part of the labor force, agricultural development, and religious beliefs, traditions, and cultural beliefs. When governments provide pensions or support pension programs, couples know that 1, they will be financially supported when they are older, and 2, that they will not have to rely on their children to support them. With the security of pension programs, couples have fewer children. If there is likely to be no money in the pot upon retirement, an empty nest egg in other words, older people must rely on their children to support them in old age. Thus, they have many children. People who marry and have children at an older age have fewer children. The age of marriage stems from both economics and culture. When women are educated and empowered, they get into the workforce and delay marriage. This reduces the total fertility rate. India has a cultural history of early marriage. Early marriage reduces the time between generations, and this results in higher birth rates. But changes in Indian law have raised the minimum age for marriage to 16 with parental consent. However, child marriage is still widely practiced in India. Let's take a look at the effect of early marriage on population in the next 2 slides. Here is a family with 30 years between generations. Starting with an initial couple, every other individual in the image is a female with a TFR of 2. Through 90 years, only 14 people have been born. But here is a family with 15 years between generations, early marriage, starting with an initial couple and holding each female to a TFR of 2, over 120 people have been born in 90 years. With urbanization comes fewer children. Couples living in urban areas have higher expenses and live in smaller spaces. For practical reasons, urban couples have fewer children. But possibly more importantly, urban couples tend to be educated and employed, marriage is delayed, child rearing is delayed, and contraceptives are accessible and used. In many societies, children are an important source of income for families. Poverty creates a demand for child laborers. When children are important to the economics of a family, birth rates are higher. Agricultural societies tend to have higher birth rates than industrial or service societies. More children to help with the work on a farm increases birth rates. As well, rural communities may have less access to education or contraceptives and may have a more traditional view of women's role in the family. And lastly, although I'm not sure I've exhausted all of the factors that influence birth rates in human populations, religion and local cultural traditions also play a role. For example, in societies that do not believe in contraceptive use, birth rates are likely to be higher. For example, many people in Brazil are Catholic, and the Catholic Church does not promote the use of artificial birth control. For many years now, Brazil's crude birth rate has been high. That said, government programs in Brazil have been effectively reducing the birth rates, as many Brazilians are using contraceptives despite their affiliation with the Catholic Church. In many parts of Asia, families hang on to a cultural preference for boys. As a result, many embryos identified as female have been aborted. This has had the effect of reducing the birth rates because the male-female ratio in the society is not 1-to-1. notice the ratios in the graph shown here. In many of these traditional conservative societies, there are cohorts of men unable to find marriage partners. According to the data in this graph, the asymmetry in the male-female ratio is increasing from 1990 to 2005. This is not a good sign. The factors that influence the natural increase rate of human populations, particularly the birth rates, are far more complex than those that influence the natural increase rate of wild populations. In this slide, I've crossed out the biological factors, the internal factors, because clutch size, age of reproductive maturity are not very important in the growth of human populations, not nearly as important as the economic, political, and cultural factors that I've covered in the last 10 slides here. You should be able to fill in the blanks of this slide and certainly be able to write more than 3. The external factors, such as food scarcity, lack of water, increased disease, remain important in the rate of growth or decline of local human populations. These external factors would be the density-dependent factors that limit population growth. Remember that infant mortality reflects the general level of nutrition and health care of a society. Governments are working to reduce infant mortality by increasing the food supply and providing greater access to good nutrition, improving the sanitation and personal hygiene, improving access to health care such as antibiotics and vaccines, providing access to safe drinking water, and improving the access to good nutrition. In these images, you can see the importance of clean water, clean living conditions, access to health care, and sufficient food in reducing infant mortality. Societies with high levels of infant mortality have higher birth rates. The images on the last slide were clearly from less economically developed countries. Less economically developed countries have contributed most to the growth in human population on Earth over the last 50 years. And that brings us to the end of Population Biology and Human Populations, Part 5.